Hey everybody, Evan Kirstel and Irma Rastigaiva with Avira Health. Today we are super excited to chat with Dr. G, Dr. Geeta Nayyar, physician, entrepreneur, speaker, author. We're so excited to have you here, Geeta.
Thank you so
Thank
much for having me. Thank you so much for having me.
Well, thanks for being here. You have an extraordinary travel schedule, so we appreciate your time. And we're going to dive into a lot of really fascinating topics, we think. Maybe for the audience here, introduce yourself, your body of work, and your current mission.
Sure. Thank you. I appreciate that. Well, I am the author of Dead Wrong, a look at myth and disinformation in the digital age of AI and TikTok and all the things I know everyone in your audience knows and understands. I am the former chief medical officer of AT&T, Salesforce, and this has been my work every day at big companies trying to tackle this problem. So I'm just really excited to be having a conversation today and hope we give some of your audience members an opportunity to think about this and where they play in the ecosystem in a post-pandemic world.
Well, it's such an important topic, and you've been just a voice of reason and change for so long. So let me dive in. I mean, medical misinformation, there's a pandemic of that around as well. Maybe give us a little bit of your vision on how, healthcare professionals and all of us can really counteract, combat misinformation in this digital and social era we find ourselves in.
Thanks, Evan. Well, the first thing is that it has to be a priority. And I know that, I'm not naive. I know there's no one at a hospital system, a pharma med tech company, or a payer that's in charge of myths or disinformation. But there are people in charge of patient engagement, brand
Mm,
loyalty, patient acquisition and retention, value-based care, EHR optimization. And the real crux and point of the book is it's all connected to this undercurrent of myth and disinformation because we're a services business, right? Consumers are coming to the healthcare industry to have answers to the questions they have about their health. And if they're not able to get it quickly, efficiently, and conveniently from their doctor, paid for by their payer, brought to you by the therapeutic of your pharma or device or medtech company, then they're going to that doctor on TikTok and they're going to that other website and they're going to that other shaman, they're going to that functional medicine specialist. This
mm,
directly affects the bottom line of the healthcare industry because when all of that also goes south, those patients meet the docs in the ER, right? Which is exactly what we saw during COVID, which wasn't really that long ago. So this really is the issue of our generation. It should be a forefront issue as we think about artificial intelligence and all the amazing, really cool things it can do. But this has to actually be a priority of how is your organization handling this and thinking about this.
wow,
That's
great points.
such an important topic. So let's dive even deeper into your book, Dead Wrong, that addresses critical issue of healthcare misinformation, as you were just saying. I'm curious, what inspired you to write this book? And what are some of the pivotal moments that you discuss in it?
Thank you. I really appreciate that. So the first reason is the reason I wrote it is because, like all of you, I was sitting at home watching this tragedy unfold, and I was so angry as a doctor. I was just so angry to see
Mm,
all of the craziness around hydroxychloroquine and bleach and the question around masking and vaccines. It was really a really tough time, I think, for so many of us in healthcare to just see people dying senselessly and effectively dying from preventable death. And I was reminded of when I was in training in the early 2000s at George Washington University, where I did my residency in DC. And it was the height of the HIV/AIDS epidemic. And it was very similar. People were very confused about the transmission of HIV/AIDS. It was thought to be only possible to be transmitted in a homosexual population. There was not an understanding of prevention. And people were dying, and people were dying very young. And so the book actually starts out with one of my first patients that died from AIDS. And by the time you see these patients, whether we're talking about COVID, whether we're talking about AIDS, whether we're talking about any number of things in healthcare, it's simply too late. And as a physician, particularly as a physician who was in training, who was in it for the science and to save lives, it's debilitating because there's literally
mm.
nothing you can do. There's literally nothing you can do as a physician, as a healthcare industry, except watch someone pass. And so I felt very inspired to tell this tragedy because in my mind, it was happening again, and it will continue to happen again. And at the height of the HIV/AIDS epidemic, they told us this was a once in a lifetime thing, and we were going to be better doctors for having lived through it. Sound familiar? We were told the same thing during COVID, right? This is a once in a lifetime thing, never going to happen again. And we know this is not the last pandemic, and we know that this happens every day in healthcare, whether you're talking to your aunt or uncle over Thanksgiving dinner, and exchanging, home remedies, or, what garlic and ginger really can do for your arthritis. This continues to happen every day in healthcare, and it's important for us as healthcare leaders to acknowledge it and hit it head on, and make sure our consumers trust us for the information before they're going to other places.
Wow, wonderful sentiment there. And switching gears a bit, throughout your career, you've witnessed, participated in the digital transformation of healthcare's systems and processes. We're not there yet, of course. Too many fax machines, too many clipboards and written notes floating around. But describe this as sort of defining moment in health IT, health tech, when you saw its potential impact and opportunity for patient care enhancement.
For me, I have to say again, as a doctor that trained during the EHR revolution, I would say that was a really important viewpoint. And I talk about this pretty at length in the book as well. When you're a physician in training and you're going from paper to an EHR, you're really sitting at that crux, right, of yesterday and tomorrow. And I remember being very inspired and saying, wow, this is the future. I mean, I saw analytics, I saw telemedicine, I saw predictive and precision medicine in the 2000s as soon as I, touched the EHR. But here's the thing, right? We did it all wrong. And even at that time, we did it all wrong. And so, how I actually ended up in health tech was exactly that. We were implementing our EHR. I understood what it could do. I was also doing an MBA at the time. And I went over to IT and said, I think I know what you're trying to do with this, but you're doing this thing all wrong. Everyone hates it. The doctors hate it. The nurses hate it. The patients hate it. Nobody looks anyone in the eye anymore. And that really launched my health tech career. And so that's in many ways where we're still at, even though we've made tremendous progress. We just have to continue to remember that the mission is patient care. And with patient care comes physician care as well.
Wonderful.
And with going back to misinformation, but from a patient perspective here. So obviously, in order to combat misinformation, patients need to be empowered to understand how to find good information. And with that comes health literacy. How can we, do health literacy at scale? You've been in the system, you worked in the industry. How can it be built at scale? And what role do the healthcare leaders play in fostering that kind of environment?
Well, I think it's actually bigger than healthcare. When we talk about health literacy, we're also talking about our schooling, our education, our policies, the way that we have incorporated other elements in curriculum into school. I think this certainly needs to be examined, particularly in a post-pandemic world. One of the things I remember most tangibly from COVID was the fact that it was so easy to confuse the population about what the difference between a virus and a bacteria was. Like there is some basic things that we all need to understand. And you don't have to be an MD, you don't have to be a PhD, but there is a basic health literacy that does need to happen. And I think that's probably much bigger than where I sit, but I would say that first. And then secondly, as an industry, one of the chapters I go through the use case of the Cleveland Clinic. So Paul Mattson, head of Marcom at the Cleveland Clinic, did just a wonderful job at recognizing that the Cleveland Clinic had an outstanding world-class brand, but for some reason was alienating the local population. And he actually talked through how he scaled the literacy of the community as well as the doctors there and made them very reachable and approachable, but he never asked his doctors to be marketers. He never asked them to be influencers on social media. He's marketing. He did his job, right? All he did was turn the camera on for his doctors, made sure they combed their hair, made sure they said things that were reachable, relatable, and factual. And I think we need more of that, right? We need to stop asking our doctors to do more, just like we would never ask a marketer, hey, you should really learn medicine. We have to start working collectively as a team and recognize that health literacy is actually marketing and communications in many ways, right? In many ways, when we talk about patient engagement, half of patient engagement is patient education. And if you're not working with marketing and yet IT is in charge of the patient engagement technology, it's a huge myth. And it's a huge myth for marketing as well, because marketing is in charge of that brand. Marketing is in charge of the loyalty of patients and making sure that they feel their brand is trusted. So one of the things that happened during COVID is we did see teams working cross-siloed. It was such a big crisis that, all of a sudden the whole C-suite was working together. I'd love to see that continue to happen, because I think that when that happens, we really elevate the bar, and health literacy is not owned by one function. It's owned by many functions.
A brilliant sentiment. Irma, do you want to follow up with that?
Yeah, I just wanted to dive maybe deeper into this gap that maybe currently still exists between clinical medicine, business, marketing, and how does digital health, maybe something could be in patients' hands, but still connected to kind of the traditional way of practicing medicine. How can we address that gap in a better way and to pull patients in and empower them?
Well, I think that's actually perhaps one of the biggest opportunities of digital health. Is digital health touches all of those things. Whereas before tech, before digital health, it was much easier to say, no, I'm in my place. I've got the chart, I've got the discharge, I've got, pre-visit, but now it's all connected. If you're doing digital health right, it's all connected. So I think that's one, a recognition that we have technology that connects the whole experience. And then two, as we talked about before, it has to be a priority. Again, I'm not naive. There's no one in any boardroom saying who's in charge of the mis and disinformation strategy, right? But for everyone that's in charge of patient acquisition, retention, brand loyalty, value-based care, this is one of those tactics that you have to hit, right? Is to say, how do we proactively get to patients before someone else sells them that vitamin for just $29.99? You can click here, right? And that's the thing. That's the risk, is that you're actually losing revenue. You're actually losing revenue, and you're losing a chance to build that trust before someone else has gained it. And in today's world, if you don't have a digital presence, you don't have a presence, right? Whether you're an individual physician, we've literally seen physicians build practices on top of TikTok. Solo practitioners build amazing businesses on TikTok. It's wonderful, but that's just a pocket, right? The question is, how do you do it at scale? And the real impact is on healthcare organizations to do this at scale and to connect those dots, because the consumer isn't disconnecting those. They're looking for wellness, they're looking for lifestyle, they're looking for prevention, and they're looking for treatment in all the same places.
Oh, so such an interesting thought. So you've been named one of the 25 top voices, influencers in digital health. So congratulations for that. Well deserved. Um, any messages to your fellow practitioners on trends and opportunities in digital health to keep an eye out on?
I think the biggest buzz right now, as you all know, is we're talking a lot about artificial intelligence, and I am just as excited as everyone to see the opportunities that we have with AI. I think the biggest lesson we have to remember, though, is we were told the same thing about the EHR. We were told the same thing about the internet. This is not the first time, is my point. This is not the first time that we have a groundbreaking innovation coming into healthcare. And I think, like every innovation, we should embrace it, but we should also understand the problems of today and use these technologies to solve the problems of today. And those problems remain: physician burnout, staff shortages, a lack of trust in the healthcare system, and how we can do better preventative medicine rather than reactive medicine, right? And ultimately taking the friction out of healthcare, because, we could do a whole podcast on prior auth, right? And a whole podcast on pajama time and documentation. So to me, there's amazing opportunities that maybe aren't so sexy, right, Irma and Evan? But they could really solve big problems in healthcare. I mean, prior auth alone, documentation alone, those are low-hanging fruit. We shouldn't get so distracted by the shiny objects of maybe robots are going to come start seeing patients and delivering babies. I think we've got to focus on the problems of today, solve those, and then be that much more excited about the problems of tomorrow that we can solve quicker, faster, and better.
So you started addressing already. Then my next question is about how your role as a physician and somebody who's been on the front lines and had experienced the HIV epidemic, and now bringing that experience to industry and being the executive medical director at Salesforce, for example, talk more about specific uses of technology to empower frontline health workers and maybe how to combat that burnout and other issues facing the whole healthcare system?
So, I was the chief medical officer of Salesforce during the pandemic, and it was an incredible role. It was incredibly humbling. And I talk a little bit about in the book in terms of the just being very proud of the way we led with integrity and we led with science. One of the things I learned in that period is big employers are public health entities, right? As the CMO of 80,000 employees across the world, I became a public health expert real quick, right? So I think we have to realize that our employers are actually being put in the position to do public health every day. So whether it's the flu vaccine, whether it's benefits enrollment, the reality is that is public health in today's modern world where we have gaps. We have gaps, depending where you are in the country, you can't get an appointment with a doctor for 3 to 6 months. You can't find, I'm a rheumatologist. There's a handful of us in my state, right? So you also sometimes just can't get appointments with folks. And so we have to understand that the realities of healthcare today and that burnout, we have contributed to burnout as technology leaders. As a technologist, we knew that the EHR was not perfect, and we understood that the EHR was not built for the physicians. And we solved one problem, but we created 6 new ones and 10 new clicks, right? So we have to acknowledge that. And in this next era of whatever we do with tech, whatever we do with AI, whatever we do with reimbursement, we have to address that you cannot divorce the patient experience from the physician experience. If the physician, if the nurse, if the care team is burnt out and not well, you will not get good care. It doesn't matter how great the technology is. So we have to really start marrying those two things together and realize that that's the reality we live in today. And so how are you really solving for both?
Such a great point. We're seeing the rise of retail healthcare, this blockbuster announcements by Amazon, the rise of CVS and Walmart as providers. What are the opportunities? What are the risks there with these new models and new players entering the industry? What's your, you have a unique perspective here. What's your take?
Well, look, I call it the retailization of healthcare. And I actually think it's terrific because the reality is the healthcare system, the traditional healthcare system is not set up for success. I think we all understand that and acknowledge that. And I certainly don't work for Walmart, but one of their claims to fame is that, everyone in America is within, I think, 8 minutes or 8 miles of a Walmart, something like that.
Oh, wow. Yeah. Yeah.
And hospital systems aren't, right? And the hospital systems aren't. That's just not how we've set up our hospital systems. So it's terrific that they have a brick and mortar system. It's terrific they're embracing rural America and virtual visits. Same for CVS and Walgreens. I do, however, think that there is a place for the retailization of healthcare, and there's a place where it doesn't make sense. And I'll give you an example. So in the middle of a pandemic, when you need to vaccinate the whole country, awesome. They rose to the occasion. They got us vaccinated, and we got in and out, and we were able to grab milk and eggs while we waited, right? So great experience, great convenience, very transactional, right? So the retail space is terrific for that transactional, low acuity visit, blood pressure check, eye check, glucose check, simple, low acuity things. Where we get into trouble is when we try to treat chronic diseases in those places. And I'll give you another example. So I'm a rheumatologist. I see lupus patients, rheumatoid arthritis patients, complex diseases, complex treatments, complex chronic issues. So the problem becomes when a lupus patient goes into a CVS for a blood pressure issue and her blood pressure medication is tweaked, prednisone perhaps is tweaked, and actually ends up undoing a lot of the work that I've done as a rheumatologist to treat their long lupus disease and neglects to look at certain kidney function as it relates to lupus. So there are many ways where we can get into trouble when we have disconnected care, because ideal care is cradle to grave with the doctor, with the specialist, with the facility, There are just ample studies that show us that is the ideal way to have a good outcome and to decrease costs, right? So I think the reality, though, is that's just not the system that we live in and operate in and that people have access to every day. So I do think the retailers are rising to the occasion and filling the pieces that they can, right? But nobody's going to CVS to have a baby. No one's, going there for
hopefully not.
pilfering. And so that's the challenge is also the consumer understanding what a retailer is good at and good for versus, hey, you've really got to see your doctor, and understanding that long-term relationship and value is really important to your health.
Yeah, such an important
This
sentiment.
is so interesting. And this reminds us to get, you're a practicing physician, in addition to being a recognized thought leader and one of the leading voices in healthcare technology, you're a practicing physician. So tell us and our audience, how do you personally balance those two roles, being there with patients day in, day out, and influencing the future of technology and how to bring technology into this space?
Well, the truth is I got into the health tech industry because I love patients and I love patient care. So I do enjoy seeing patients. I don't do it a lot. I practiced at the University of Miami with the medical students at the Docs Clinic, which is an indigent clinic in Little Haiti. So I see patients when I can. The truth is it's very difficult. It's very difficult to balance things, but I am squarely in the midst of it and really do it when I can. But it is difficult, but I find that it keeps me very relevant, very grounded. And more than that, I love working with the medical students. Actually, one of the medical students that I mentor did the artwork and the graphics with my daughter in the book. So every chapter has a graphic, and it's just a really cool thing that they're now both published artists in a healthcare book. So it's pretty neat.
Let's see the book. Can we see the book cover? And
if you haven't gotten one, I need to send you.
Wow, that's a great cover. Very impactful.
Into the book, but yeah, and show us some of the artwork.
Yeah, I'm going to show you your girl. So it's between 11-year-old and a 20-year-old. You see it?
Oh, that's brilliant! Look at that. That's amazing. So that's pretty good.
Just neat. I'm really proud of them. And the last picture is actually the two of them doing the artwork.
Oh,
that's great.
Yeah, that's cute.
Yeah.
It really kind of humanizes all these topics of misinformation and
you really put yourself out there. It's much appreciated. I'm sure you have many slings and arrows as well. A lot of negativity out there. So kudos for putting yourself out there in a tough environment on these social platforms. What are you looking forward to the rest of the year? I can't believe it's almost Thanksgiving. Any speaking events or trips or otherwise now or in the new year?
Thank you. I do. I have plenty of speaking engagements between now and the end of the year. I am looking forward to getting off a plane and spending more time with my family. And Diwali is this Sunday, so I'm really looking forward to Diwali, and then Thanksgiving, and then Christmas, and then Festivus. It's all one big Festivus. So it's a fun time of year. But more than anything, I'm so excited that people have now been able to buy the book, get the book, read the book, and I love hearing people's feedback. It's really it's one thing you get very nervous to get a book out, but then once people read it, you're very hungry first. What'd you think? And the bigger now, what will you do with this? Right now, I want to see people actually take action more than anything.
Oh, so some of the feedback is people actually wanting to implement this and follow these practices in their own.
Yeah, absolutely. That's definitely the hope, Irma. So the end of the book is focused on solutions, right? The end of the book is focused on how do you attack this? What should you do? And again, don't pretend to have a silver bullet. Don't pretend to have all the answers, but just from my lens and experience. And everyone in the book, there are many experts in the book, from Larry Brilliant to Peter Hotez and Megan Rainey and Sachin Jain. I mean, we really covered the gamut of experts in the field to bring it all together and really show both the problem as well as possible solutions.
Fantastic.
All right. Well, thanks so much for sharing just a few minutes of your vision and insight. So appreciated. You really do put yourself out there on social media. And I'd encourage everyone, watching, listening, to reach out to Dr. G with any questions or comments, speaking engagements, what have you. She's a delight to chat with on social. And thanks everyone for watching.
Thanks so much for having me, Evan and Irma. Really appreciate you. And if I don't see you, have a wonderful and safe holiday.
Thanks. Likewise.
Enjoy your time.
Thanks, everyone.